Do you think your child has difficulty listening to you? Do you suspect that your child may have a hearing problem? Well, you can watch this video to find out. Hi everybody, I'm Mansa. I'm a speech language pathologist and an audiologist. And in this video, I'm going to tell you about how you can identify if your child has a hearing loss. First thing, hearing loss is not something which affects only adults or older individuals. It can affect children as well. When children are born, usually an audiological screening is done to find out if your child may or may not have hearing loss. Usually this is done for all children. Even if the children pass this at a later age, they can still get hearing loss. It could be due to ear infections or any other causes. So how do you identify this? First thing is you need to go to an audiological evaluation. But there are a few things which you can look out for to see if your child could have a hearing problem, because a hearing problem at a young age can affect their speech development, as in pronunciation of the sounds, learning new words, speaking in sentences, speaking like other children of their age. So it's always best to identify it early. The earlier you identify, the earlier you can treat it and make them speak much better. So I'll tell you a few things you need to look out for to find out if your child has a hearing loss. First thing, see if your child responds to their name. When you call out their name, do they turn? See if your child finds out if a phone is ringing. Do they look for it? If somebody rings the bell, do they look for it? If you call them from a different room, because hearing loss has different levels. It could be that they can hear the soft, loud sounds but not the soft ones. So calling them from a different room, do they respond? The next thing would be to see if they smile when you're talking to them. They actually respond to you. They enjoy talking to you. Next thing would be if they enjoy listening to music. No, without a video, just music. Do they really enjoy listening to it? When there's loud sounds like a cracker, do they startle? But it could be far away, but still we startle, right? Do they startle? Do they actually learn new words? Are they learning new things, or are they actually struggling to learn? Are they having some pronunciation problems? Some pronunciation problems could be because of hearing loss. A lot of the pronunciation problem could not be, but some of it could be. And last but not the least, does your child have any kind of discharge, itchiness or pain around the ear? This kind of ear infection could also cause hearing loss. So what do you do if your child has any of these, or what do you do if you think your child could have any of these? First thing, go to an audiologist. An audiologist will be able to check your hearing, check your child's hearing, find out what is the exact level, tell you what to do. You may either have to go to an ENT for a medical clearance, that is, it could be an infection and ENT could give you medicines to clear that, or other options would have to be decided, such as using hearing aids and other things. And most importantly, if your child's speech is affected, you have to attend speech therapy. So these are a few signs which you can look out for if your child has a hearing problem. Thank you for watching.